السلام عليكم. اليوم الموضوع السيمينار عن ال complexity of odontogenic infection. بالبداية نعرف بعض المصطلحات. Inoculation هو ال enter of the pathogenic microbe into the body without cause disease. Infection عكسها. It is pathogenic microbe enter to the body and cause inflammation. Inflammation, it is the localized reaction of vascular and connective tissue of the body to the irritant that cause development of the exudate rich in protein and cell. The inflammation may be caused by micro, physical, and chemical factors. There are three types of inflammation. Acute inflammation, characterized by rapid progression and associated with typical signs and symptoms. Subacute inflammation is a transition phase between acute and chronic inflammation, while the chronic inflammation it is a procedure that presents as prolonged time frame with slight clinical symptoms. Body response to infection. Number 1, hyperemia. Number 2, precipitation of the fibrin network to the wall. 3, it is the phagocytosis of the bacteria and dead cell. 4, disposal of necrotic debris by macrophage. Clinical signs and symptoms of the infection include redness, swelling, pain, and loss of the function. Odontogenic infection include first case is the periapical infection, arise when bacteria from infected necrotic pulp from the carious tooth or traumatic exposure of the pulp invade the periapical tissue through apical foramen. Clinical features include non-vital tooth, tooth tender to the percussion, and periapical region is tender to the pressure. Tooth may be mobile. Intense throbbing, pain. If treatment is delayed, the bone resorption will allow the pus to drain under the periosteum. Second is the periodontal infection is arise from pre-existing periodontal pocket that caused by food impaction, repeated occlusal trauma. The clinical features include teeth involved are not necessarily non-vital, redness and swelling, pain is continuous or throbbing but usually less than in acute periapical infection. Last one is the pus may discharge from the gingival margin and the tooth may be mobile. This is the periodontal infection. 3 is the pericoronal infection, also called pericoronitis. Pericoronitis definition is infection of the soft tissue that covering the crown of the partially erupted tooth, especially partial erupted impacted lower third molar. Etiology include food impaction, trauma from the opposing tooth, and lowering of the host resistance. There are three types of the pericoronitis. First one, chronic pericoronitis, characterized by asymptomatic. Second is subacute pericoronitis. It characterizes dull pain. The gum pad may be tender and red. Acute pericoronitis is severe pain and cause limited movement of the mouth. Intraoral swelling and they may be extraoral swelling as well as fever. Treatment of the pericoronitis done by drainage of the pus if present. If no pus present, good irrigation of the pericoronal space with normal saline. Antibiotic and extraction of the impacted tooth. Spread of odontogenic infection. أول حالة عندنا هو cellulitis. Cellulitis result from spread of the infection into the loose connective tissue, and it causes warm, diffuse erythematous and painful mucosal or cutaneous swelling, and doesn't result to formation of large amount of the pus, and the most common causes of the cellulitis is the streptococci. This streptococci produce enzymes such as streptokinase that break down fibrin, connective tissue, ground substance, and cause rapid spread of the infection. بالنسبة للتريتمنت نعطيه antibiotic أو remove للcauses of the infection. Incision and drainage indicated if there is no improvement. Spread of odontogenic infection. The second one is suppurative infection, characterized by abscess formation that can be defined as a thick-walled pocket of tissue containing pus. This pus consists of necrotic tissue, dead and living bacteria, and dead white cell, and the most causes staphylococci and bacteroid. This bacteria produce enzyme coagulase that coat the bacteria with fibrin and reduce the ability of the host cell to phagocytose. The treatment is by incision and drainage and give antibiotic. Factors that affect on spread of the infection: virulence of microorganism, patient immune system, anatomical factor that include site of the source infection, point at which pus escape natural barrier, route of infection, direct throughout the tissue, lymphatic to the regional lymph node, and the last one is bloodstream. Infection of the facial space. أول حالة عندنا هي submental space infection. الاناتوميكال باوندري مالتها تكون between المايلوهايويد muscle above and the platysma muscle and deep cervical fascia below. Laterally هو lower border of the mandible and the anterior belly of digastric muscle. It contains submental lymph node source of infection مالتها تكون direct to indirect. بالنسبة للدايركت سورس تكون from the infected lower incisor and canine والskin والlower lip. بينما الاندايركت سورس تكون from the submandibular space. Site of the incision and the drainage تكون extraoral horizontal incision and تكون through the skin posterior to the crest behind the chin and maybe drainage intraorally through the mentalis muscle عن طريق اللابيال vestibule. Submandibular space infection. Anatomical boundary مالتها superiorly هو المايلوهايويد muscle, anteriorly and posteriorly anterior and posterior belly of digastric muscle inferiorly. Posteriorly it is the hyoid bone, laterally platysma, deep fascia and lower border of the mandible. This space contains submandibular salivary gland and lymph node. Source of infection, the lower molar teeth, especially second and third molar. Infection can also spread from the tongue, posterior part of the floor of the mouth, with upper posterior teeth, also maxillary sinus. Site of incision and drainage. It is extraoral incision that made parallel about 2 cm below the inferior border of the mandible to avoid injury of the facial nerve. This is the submandibular space infection drainage. Number 3, it is sublingual space infection. Boundary, it is V-shaped space and bounded anteriorly and laterally by the mandible. Superiorly, it is the sublingual mucosa. Inferiorly, it is mylohyoid muscle. Medially, geniohyoid and styloglossus muscle. Source of infection, from the premolar and less commonly from the molar. Indirect, the infection may be spread from the submental and submandibular space. Site of the incision and the drainage, intraorally and extraorally. بالنسبة للانتراورالي عن طريق incision through the mucosa only parallel to the Wharton duct and lingual cortex in the anterior-posterior direction away from the sublingual fold, while the extraorally through the submandibular and submental incisor through the mylohyoid muscle. Ludwig angina. It is massive firm cellulitis that affect the submandibular, submental, and sublingual spaces bilaterally, and it is a very serious condition that requires prompt treatment. The major causes is the dental infection, also submandibular gland infection, mandibular fracture, and soft tissue laceration. Sign and symptom include firm, extensive bilateral submandibular swelling intraorally. Number 2, swelling of the floor of the mouth. Number 3, patient is toxic and feverish, and there is dyspnea and difficult in swallowing. بالنسبة للتريتمنت لللودويك انجينا نستخدم securing airway, surgical drainage, antibiotic, and general anesthesia should be avoided. This is the Ludwig angina. Buccal space infection. Boundary, it is the buccinator muscle and buccopharyngeal fascia medially. Laterally, it is the skin of the cheek. Anteriorly, labial musculature. Superiorly, zygomatic arch, and inferiorly, it is the inferior border of the mandible. Contain the buccal bud fat and facial artery and the parotid duct. Source of infection, can be related to both jaw upper and lower. The origin of the proxenator muscle from the alveolar bone and the apex of the upper and lower premolar and molar. Site of incision intraorally, it is the horizontal incision in the buccal mucosa below the parotid duct, and the incision should be through the mucosa only. بعدين the space should be entered bluntly using artery forceps عن طريق البروكسينيتر muscle حتى نتجنب الدمج للفيشيال artery and nerve. Masticator space infection, also called the submastitic space. تكون located between outer surface of the ascending ramus of the mandible. Medially, it is the masseter muscle. Laterally, the parotid gland. Source of the infection, usually it comes from the molar teeth, especially the lower third molar, and it can also occur after fracture of the angle of the mandible, or can also spread from the buccal space. This is infection يميزه هو الماركد تريسمس. راح يصير هنا بهاي الحالة تريسمس. The site of the incision extraorally below and behind the angle of the mandible حيث نسوي incision through the skin and subcutaneous tissue, then by blunt dissection through the platysma muscle and deep fascia. After incision, the attachment of the muscle at the angle of the posterior elevator, periosteal elevator, is inserted beneath the muscle and in close contact with the outer surface of the ramus of the mandible. Intraorally, drainage can be carried through incision along the anterior border of the ramus of the mandible، لكن بالانتراورال يكون very difficult لأن أكو تريسمس. هذا هو submastitic space. Pterygomandibular space infection, located medially by the medial pterygoid muscle and laterally medial surface of the ramus of the mandible. The superiorly, it is the lateral pterygoid muscle, parotid gland posteriorly, and constrictor muscle of the pharynx anteriorly. Source of infection, it comes from the molar teeth, especially the lower third molar. Also result from من inferior nerve block with contaminated needle or solution, and also can be spread from submandibular, sublingual, and infratemporal space. Site of incision extraorally, it is the same as in the mastitic space لكن هنا تكون directed to the inner surface of the ramus. Intraorally can be drainage through incision made just يكون medial to the pterygomandibular raphe. Lateral pharyngeal space infection. هنا يكون هو عبارة عن space extend from the base of the skull to the hyoid bone, and it is conical in shape. The lateral border مالته include the medial surface of the medial pterygoid muscle, and medial wall is the superior constrictor muscle, posteriorly by the parotid gland, and anteriorly the pterygomandibular raphe. This space can be divided ينقسم إلى قسمين anterior و posterior وتتضمن بيناتهن الكاروتيد sheath. Source of infection هو upper and lower molar teeth, most commonly from the lower third molar, and also تكون from the submandibular, sublingual, and pterygomandibular spaces. Site of incision intraoral incision يكون medial to the pterygomandibular raphe ويكون medial to the medial pterygomandibular muscle. Extraoral incision يكون ويا level of the hyoid bone anterior to the sternocleidomastoid muscle. Retropharyngeal space infection يكون extend from the base of the skull to the upper mediastinum, and it bounded anteriorly by the posterior wall of the pharynx, posteriorly by the ulnar fascia. The source of the infection هو الupper والlower molar teeth. والسبيس يكون الانفكشن السبريد مالته عن طريق التيريجومانديبولار والسبمانديبولار and sublingual space. Also result from the nasal and pharyngeal infection. Site of the incision extraorally يكون هنا الانسجن anterior to the sternocleidomastoid muscle below the hyoid bone. And the carotid sheath carotid sheath should be retracted laterally. Some authors advocated intraoral drainage can be incision along the posterior pharyngeal wall in extreme trendeblug position and suction. Must anesthesiologist prepare tracheostomy to secure the airway. هاي هنا الصورة مال retropharyngeal space infection. نشوف الردنس هنا مبين قده. هذا يحتاج درينج. Last one, it is the peritonsillar abscess. Anatomical boundary مالته located between the connective tissue bed of the phacoidal tonsils and the constrictor muscle of the pharynx. Source of the infection, it is the result from tonsillitis, but it is occasionally a complication of the pericoronitis of the lower third molar. Cause swelling of the anterior pilar of the fauces and the bulge of the soft palate of the affected site. Site of the incision. Incision is placed in the point of the maximum fluctuation. This can be done عن طريق under local anesthesia. إذا استخدمنا general anesthesia هنا الانستيزيا should be لازم يكون الدكتور experience and good suction be available. ليش؟ حتى نمنع aspiration and the patient should be in the head down position. راح نستخدم هنا الفيديو حتى تشوفون الدرينج للسبمنتال انفكشن شلون يصير. قلنا يكون parallel to the inferior border of the mandible. لازم نتأكد انه كل الباس يطلع.
Assalamu alaikum. Today we will be talking about infection of space in the relation to the upper jaw. The first space we will be talking about is upper lip infection. Infection of the upper incisors and canine can spread to the upper lip, usually on the oral side of orbicularis oris muscle and points in the vestibule. Infection of the upper lip can lead to serious conditions like orbital cellulitis or cavernous sinus thrombosis. Incision or of drainage is made near the vestibule intraorally. And here is some pictures of the condition that may lead cavernous sinus thrombosis and orbital cellulitis. The second one is canine fossa infection. Canine fossa infection lies between the canine fossa and the muscle of the facial expression. Source of infection mostly is the canine and first premolar, but the infection can spread from upper incisors teeth also. Infection occurs when it spreads in the area above the origin of the levator anguli oris and it's directed towards the medial edge of levator labii superioris. It may lead to periorbital cellulitis and cavernous sinus thrombosis. Incision for drainage is made intraorally, horizontal incision in the buccal vestibule. The third one is buccal space infection. Infections spread from infected upper molar teeth, where it spreads buccally above the attachment of buccinator muscles. They are readily diagnosed because of marked cheek swelling, but with minimal trismus or systemic symptoms. Sometimes the buccal space is reported to be the most involved facial space by dental abscess. The fourth space is supraperiosteal abscess in the palate. It lies between the palatal mucoperiosteum and underlying bone. Pus may accumulate beneath the mucoperiosteum, leading to its separation from the underlying bone. Source of infection, it may spread from the apex of the lateral incisor, which is close to the palatal bone. The swelling causes palatal bulge between the gingival margin and the midline. Site of drainage, antero-posterior incision parallel to the greater palatine vessels. Here is some picture about supraperiosteal abscess found in the palate. Maxillary antrum or maxillary sinus. Infection from upper molar and premolar may spread to the maxillary antrum. This depends on the size of maxillary antrum and length of the root. It may lead to acute sinusitis with facial pain that worsens on bending or leaning forward. The infection may lead a chronic course leading to mucosal thickening and polyps. Pus may drain partially throughout the sinus ostium. Extraction of the causative teeth leads to drainage of pus, but it may leave a defect in the floor of the sinus and cause oroantral fistula. The last space is infratemporal space infection. It's bound laterally by the ramus of the mandible and the temporalis muscle, medially by lateral trigoid palate, superiorly by infratemporal surface of greater wing of sphenoid. Source of infection: directly from upper molar teeth or throughout contaminated needle from the pterygomandibular space. Infection may spread to temporal space. There could be moderate swelling in the temporal region with trismus. Usually the patient is toxic with high temperature. These infections are serious since they can spread to the middle cranial fossa with headache, photophobia, and vomiting. Site of drainage: intraorally throughout an incision buccal to the upper third molar, following the medial surface of the coronoid upward and backward. But with the trismus, this method is difficult. Extraorally throughout an incision in the upper and posterior edge of temporalis muscle, within the hairline, passing downwards, forward, and medially. Cavernous sinus thrombosis. It's a very serious ascending infection. It can be caused by odontogenic infection, especially of the upper teeth. It can also result from upper lip, nasal, and orbital infection. Infection can spread to the cavernous sinus throughout two routes. There are two routes, anterior route and posterior route. Anterior route throughout the valvus angular vein and inferior ophthalmic vein. Posterior route throughout the pterygoid venous plexus and transverse facial vein. Clinical feature: marked edema, proptosis, ophthalmia, and dilated pupil, fever. Treatment is an emergency that requires a neurosurgical consultation. The line of treatment include antibiotic treatment, heparinization to prevent extension of thrombosis, treatment of the odontogenic cause. A principle of treatment of odontogenic infection. The clinical needs to identify the presence of infection throughout the presence of the local and systemic signs and symptoms of the infection, and whether it is cellulitis or abscess. Also to determine the state of the host defense. These can be depressed by many factors such as psychological factors, disease-related factors, immune system-related factors, and drug suppression-related factors. Dental treatments aim to eliminate the source of infection throughout endodontic treatment, periodontal treatment, or extraction. These factors should be taken in consideration. Extent of infection, patient general health, degree of trismus, biomechanical necessity of retaining the tooth. Surgical treatment aims to drain the accumulated pus to get rid of the body of the toxic purulent materials and to relieve the tissue, allowing better perfusion of blood. Method of drainage: throughout the root canal after access opening, throughout the socket by extraction of the offending teeth, throughout fenestration of alveolar bone using surgical handpiece and bar, throughout incision and drainage of an abscess. Medical treatment: it consists of suppurative care, which include hydration, soft diet, analgesic, and good oral hygiene, antibiotic therapy. Thank you.